Ruby Ahluwalia, former senior bureaucrat and founder and chairperson of Sanjeevani Life Beyond Cancer, to please join us on the dais as our moderator for the panel discussion for the evening.
So the idea was with me for a very long time, and this year when I really thought that we should do it, I initially thought of Bombay because I have the resources there, I know people there, and it is so much easier for me. But then I thought, now I live in Goa. Goa is home. Goa is also that place where cancer is increasing at one of the highest rates in the country. So Goa had to be that place. I really had to work at least 100 times harder. But today, looking at all of you here, where each seat has a person here, really makes my life. And I'm so very grateful to each one of you who has taken out time and is here. So thank you so much for that. The way we would handle the next 3 panel discussions, which are here, we would have the first panel discussion on the challenges of cancer, which will be addressed by the eminent doctors who are traveled from all over the country. The second panel discussion would be on holistic healing, as to what all goes into healing a patient, a cancer patient, completely, physically, psychologically, and mentally. So we have amazing people here who are from the field of nutrition, from yoga, from psychotherapy, from quantum healing. I'm really looking forward to that panel discussion. And in the third panel discussion, you will be listening to those who have gone through this experience of cancer, have come out of it or coming out of it, what has been their experience, what worked for them. So that is how we will try and take that direction in the panel discussion.
Ladies and gentlemen, it's my privilege to introduce our esteemed panelists who will lead us in our first discussion today, addressing cancer challenges. These visionary leaders have dedicated their lives to the pursuit of excellence in cancer care. We are also honored to have with us Dr. Vani Parmar, Chief of Breast Surgical Oncology at Head and Neck Cancer Institute of India, Mumbai, whose dedication to women's health has been instrumental in advancing breast cancer. Dr. Parmar, your commitment to excellence in surgical oncology has positively impacted the countless patients. Thank you.
Since you raised this breast cancer thing, I really want to go to Dr. Vani. And although everybody sitting on the dais is an amazing human being and very, very accomplished, doctor in the scene of cancer, but Dr. Vani Parmar was my surgeon when I went through the treatment. So I'm extremely thankful for all her, not only the treatment that she gave me, but the attitude with which she gave me that treatment, that made all the difference. So Dr. Vani, as Dr. Gopinath spoke about the breast cancer scene, and as we know, breast cancer, although can happen to men and women both, but still in women it is so very high. Women are already the responsibility burdened population of this country. All the women here, do you agree?
Totally.
Yeah, all right. So what do you think you are seeing these patients on an everyday basis? What do you think are their concerns?
First of all, Ruby, thank you so much for your kind words. I think a journey is made more easier when all the people who are traveling together are happy and walk together. And I think that's where Ruby taught me a lot. And I think not just Ruby, but many patients, they've taught me how one should approach and treat cancer. And it's not the matter of a disease, but it's more something that's affected a life, a responsibility burdened person, as you put it correctly. But again, I think I will definitely say that over the past 25 years that I've been handling breast cancer, I've seen a change in the perception of the woman who's undergoing cancer treatment. And here, I will not say the exception. Of course, there are men also who get affected by breast cancer, though that would be a 0.5 to 1%. But I think whether it's a man or it's a woman, it doesn't matter. It's the cancer which matters and how we handle it. And I think they go through even more turmoils because this is a disease which doesn't normally affect them. So they have not just emotions, the conflict of emotions is also very strong in them. The second thing, of course, how is it different for women? The problem is women have always placed themselves as the last person in the family. They don't give priority to their own health. They prioritize their family, their children, the day-to-day activities, and that's where I think there is a fallback on how treatment is kind of asked for or how they come forward for getting a treatment. And that makes a major impact. Women are the backbone of any family. Anything happens to the women, the whole family around them just collapses. And I think everyone here sitting here will agree to that. Because suddenly you don't know who's going to do the morning activities, who's going to take care of the children, how the children are going to the school, how will I go to office? That's what the man thinks. How am I going to take care of everything? I need to go to the hospital. I need to take care of her as well. So there's such a conflict that happens. In India, the peak age of breast cancer is below 50. We are around 47 years. This is the time when women have a lot of responsibilities, as I've already listed out. This is where it affects them the most, because the minute that happens, the diagnosis comes forward. Not just her own world collapses, I think the world collapses around her. It's not just her as one person. How can we change this? We can only change this by being more supportive. The society has to come forward and hold a hand and say that, okay, we are there for you, don't worry. I think that's where the major difference lies. If we don't do it, we leave everything to that one person to handle. It's just impossible. And we all need to be looking at it in a positive manner. And that's where the positive attitude comes in. Not just for the patient, but every caregiver around her, every person who's in the cycle around her, the life cycle. The doctor themselves, people forget. There's so much of burnout and stress that happens. Everyone involved in the care of that one particular person has to have a positive state of mind. And I think that is where today we are sitting here to discuss how can we have that integrative cancer care incorporated in cancer treatment.
Do you think stress has a role to play in the incidences of cancer?
We do say that there's been some life event which has been there invariably in every patient. It may not be completely so. It could be also just a totally happy person suddenly finds that there is a lump that they're feeling, and for them it's like a shock and they don't want to accept it. The mind doesn't accept it because they're not looking at or feeling or thinking of the most uncommon thing that they would ever think can happen to them. Cancer only happens to the other person, right? That's what we all think about it in the same manner. But the point is that having that stress play so much of a role, whether it is work stress, whether it is the diagnosis stress, whether it's a family stress, does have a negative impact on the outcomes of treatment. And I think that way stress has a major role to play in cancer. And one has to work around it to see how can you reduce that stress factor. Because if you reduce the stress factor, as Dr. Sudeep also mentioned, and Dr. Hemanth Malhotra, it is something very important because it helps the treatment to work better in you. The same treatment. The more stress you have, the more barriers are created for these treatments to work well.
So, all the people who are sitting here, I'm sure now we know that stress is not good for us. And we need to learn, understand those things which can help us handle our stress better. Stress will not happen is not a possibility. Stress will happen in this life. But how do we handle it in a way that the damage to the mind and the body is minimum. By the way, Satori, our course in Sanjeevani, targets that in a very big